This podcast is intended for veterinary professionals. Whilst members of the public are welcome to listen, please note that the discussions are designed with a clinical audience in mind and may include technical or treatment-related content. If you are a pet owner with questions or concerns, we always recommend speaking directly with your own veterinary surgeon who knows your animal best.
Hello and welcome to the Nupsala podcast. We're filming here today at the Veterinary Osteoarthritis Alliance conference in Loughborough, where I am accosting speakers and luring them into this rather lovely podcast room. I'm delighted today to be joined once again by Dr. Lauren Davis.
Hello.
Lauren is a qualified vet and an expert in canine sleep. So in this episode, we'll be exploring regenerative medicine and canine sleep quality. So looking at how chronic musculoskeletal conditions can affect rest, what changes owners might notice after treatment, and why better sleep can be such an important sign of improved comfort and well-being. So thank you for joining me again, Lauren. It's lovely to see you again in the reels.
Yeah, lovely to be here. And what a space. It's gorgeous. And a real buzz at the Congress as well, which is fantastic.
Great. So let's start by thinking about what normal sleep looks like in a dog.
Yeah, absolutely. When we talk about sleep in dogs, it's really helpful to think about our own sleep because it's something that we all have personal experience in, right? And actually, good sleep in dogs in a lot of ways mirrors that. So going to bed at the same time every day in the evening, having a relaxed wind down routine, not waking up lots of times overnight, not being restless in bed. But we do see some differences as well. So, for example, good sleep in a dog equates to around 14 hours of rest a day. Now that's a lot.
Yeah.
Some of that is just kind of relaxed with eyes closed. So in terms of functional sleep, if you're measuring it with electrodes and things like that, it might be somewhere more around 12 hours, something like that. But they have a lot of time in this kind of real dozy, eyes closed, looks like sleep, very early sleep stages. So if you're measuring all of that, it's difficult to differentiate. Otherwise, we could be looking at 14 hours for your average dog, healthy dog as well.
Fantastic. Yeah, I often look at my own dogs and envy their relaxed state.
Yeah, right. But for us, of course, if they're going to bed with us at 10 p.m. and waking up with us at 6, 7 a.m., that's not enough. So healthy dogs need to be sleeping during the day, and that's a really important part of healthy canine sleep, is making sure they've got access to somewhere they feel comfortable and secure to sleep in the day.
In the daytime, yeah. Okay, so when a dog is living with a chronic condition like osteoarthritis, what are the earliest sleep-related changes that we think owners might notice?
Absolutely. I think it's, again, those kind of correlations with what we see ourselves when we have pain conditions. A lot of it is about being comfortable when we're lying down. You've got a painful shoulder or hip, you start to shuffle around a little bit more. You might be rolling side to side, taking a little bit more time to get comfortable. Your time to fall asleep, which is called your sleep latency, might increase. Your sleep fragmentation, so the amount of times you wake overnight, might increase. And we see exactly the same in our dogs. They take longer to get comfortable and fall asleep, and they're more likely to wake up overnight. We might also see hesitancy around exiting and entering spaces for sleep, especially if they're harder to access, if there's any barriers, having to climb into bed, or bed feels super soft. Actually entering that bed can be quite a challenge. So you might see them kind of stood at the side thinking, making those decisions. Very similar to looking up at the boot and thinking, I really don't want to jump up into their soft pillow, actually is quite difficult. And then kind of being stuck in the bed. Well, they want to get up, but it becomes an effort to leave. So changes in exiting and entering where they sleep, and then changes in those sleep patterns as well.
Again, definitely seen that in my old dog who struggles with even just getting into position. He's managed to get himself up onto the sofa perhaps in the day, but because it's so soft, actually turning round on the sofa is quite a challenge. So yeah, he often ends up in very funny positions. From a clinical perspective then, how does pain and inflammation impact sleep? So obviously we've talked about a few mobility kind of issues, but what about the impact of pain?
It's a fascinating topic. I'm talking for a whole hour on it tomorrow because it is so much linking on a proper neurobiological level, sleep and pain. Certainly we all know that pain disturbs sleep. And that's very fundamental. That's in the psyche of everybody. Yeah. But what's really interesting is that poor sleep actually increases your perception of pain. Pain is it's a living, breathing experience. It is your brain interpreting signals. And therefore, sleep, which is an active brain process, changes how we interpret pain. So we see that if we are poorly slept, our perception of the same incoming pain signals is increased through a host of very fascinating mechanisms that I would love to expound on at length, but probably don't have time for today. But simple things like our amygdala is firing a lot more when we're underslept. We're on a kind of a fight or flight, and that
absolutely.
makes us kind of, we need to be making sure that we're ready for anything. Our pain sensitivity is much higher. Our thalamus, which interprets pain signals, all the bits that protect that and stop some of those pain signals being taken up to be processed in the somatosensory cortex, that protection wanes. So we start seeing those signals being interpreted more strongly. So loads of different mechanisms at play, many, many more. But I think it's really important that we see this pain sleep as a real negative spiral, that they both interact both ways. It's not a one-way trip.
Yeah, absolutely. And I suppose with inflammation comes pain.
Yeah, so we see the inflammation in the joints, especially in osteoarthritis. And then we see, of course, whole body stiffness, right? It's not just that when we're sleeping poorly and we're sleeping in funny positions, or we sleep for longer in one position because the idea of moving is just so difficult. Actually, then you become stiffer, and then you have more pain, and then you're less likely to want to mobilize, and we end up, there's a lot of interaction between inflammation, pain, sleep quality, and then quality of life outside of that.
Yeah, absolutely. I can really see that. And then, so what we wanted to kind of get into today was talking about how we tie the use of regenerative medicines, such as PRP, stem cells, for the treatment of osteoarthritis. What influence they might have on the dog's inflammation, on their pain, and then their sleep quality. What were your thoughts there?
We did some very wonderful research with Andy Armitage on this recently up at Greenside, looking at dogs that had come to him. By the time they're at Andy's door, a lot of the kind of classic interventions have been tried and failed, or tried and have stopped having the same impact, and they're now being presented for this kind of regenerative medicine. Whether or not they should be at these doors earlier is another whole point of discussion, isn't it? But a lot of them are kind of closer to the end of the line with these joints. The joints are in a bit of a mess. He's been over 280 dogs we've looked at, tracking their quality of life scores and their sleep scores alongside regenerative medicine. And it was absolutely fascinating to see that as their quality of life increased across emotional well-being and physical well-being, we also saw sleep quality improving in those animals. And not just for a week, we're talking weeks, months at a time of improvement. So real long-term improvements in quality of life and sleep with regenerative medicine. There in black and white, fantastic.
That's really incredible, isn't it? So what were the tools that they were using in that study to measure the sleep and the quality of life?
Yes, they were using Vetmetrica and the quality of life scoring there, and then we used the Snore Score, which is just the most...
Love that.
I know. Isn't it the best? The best
Scientists
scorer.
can be fun, right?
Absolutely. We do have a sense of humour. The Snore Score, which is, it's not a case of if X amount, then your score is bad, but the lower your score is, the better in general your sleep is. So you can use it to track changes in sleep rather than it being diagnostic of poor or good sleep. It's really a tracking tool. So the Snore Score was measured alongside all 4 quality of life indicators, and we saw correlation across all 4 of those, which is fascinating, isn't it?
Yeah, absolutely. It is really, really interesting. So what are the 4 indicators?
So they're split across physical and emotional domains. So in physical, we have energetic and enthusiastic, and we have active and comfortable. And then in emotional, we have happy and content, and we have calm and relaxed. So you can see how it really covers the gamut of well-being.
Yeah, and easy terminology for owners to understand, to be able to measure that as they go through.
Yeah, I think that's really important, and obviously you can see how lots of different conditions can impact those. It's really interesting to see where sleep and treatments that we're talking about have the most impact and when those impacts happen.
I'm really interested to read that study, and I might pop into your lecture as well.
I hope so. Hopefully it's going to be a full room.
Good. So we've talked about how pain and inflammation can directly influence sleep quality. But what about the converse? So how does kind of an improvement in sleep or worsening sleep then affect the outcomes? So what we're actually seeing in either pain scores or mobility with patients?
Yeah, absolutely. And we covered briefly just before, didn't we, the fact that poor sleep directly impacts pain in terms of the perception of the brain. But for example, one of those mechanisms comes around opioids. So both our endogenous and exogenous opioids have been shown to have less impact in sleep-deprived patients. Isn't that fascinating?
That is interesting.
And so we might, for example, see if we've got a poorly slept dog that we've got an opioid dose for to keep their pain controlled, but that pain control means that they start to sleep better, that we might then be able to titrate perhaps down their opioids, because actually, as they're sleeping better, they're more receptive to the pain relief that opioids provide, and their own endogenous pain relief systems will be more active. So there's, I think, something around titrating pain relief alongside this improved sleep is a really interesting way of looking at things.
Yeah, absolutely. And of course, you know, the theme today would be the regenerative medicine side, but all of our patients will, before they even get to the regenerative medicine stage, will have been on a variety of different pain medications to try and stabilise them before they get to that point, before
Absolutely.
they're knocking on Andrew's door.
100%. And I think regenerative medicine is absolutely fabulous, and in a lot of cases does mean that we can titrate down some of those adjunctive medicines that are being used at the same time. I very much doubt many cases arrive through regenerative medicine without some sort of analgesic program in place at the time.
Yeah.
And it's hard to differentiate what change in the analgesia program is purely the pain relief from managing the joint itself, and how much of that is feeling better in yourself. You know, if you have less pain, you feel happier, right? Dopamine helps you control pain, right? And it also helps you sleep better. Right? So all of this stuff is so integrated, it's very difficult to pick out your exact impact of one specific thing. But that regenerative medicine has so much impact on so many parts of the life of a patient, and that's why it has such excellent outcomes.
And so, you know, we're thinking about all of these things in a multimodal sense and holistic dog care, and that's one of the themes of the VOA conference this year, is kind of whole body wellness as well. So how we can tie in all of these factors into OA management is just so interesting. And so, how can our dog owners monitor changes at home?
Absolutely. I think the Snore Score is a really nice one. You can find it on the internet or speak to a clinician. You can find it for you. It's very easy to do. The idea is that it's written for owners to report on. It's quite hard, actually, because often when they're asleep, so are you,
We're asleep,
right?
yeah.
And so unless they've got quite significant sleep disturbance overnight, so they're waking you, padding about or whatever, it's quite difficult to know, isn't it? And when they're sleeping in the day, you might well be at work. So the Snore Score it lets you evaluate the bits that you can see, and at least you have a score then, and if in another 6 weeks you do it again, it gives you a trend. I would suggest not doing them too close together, because the brains are clever and they'll remember what you wrote last time. And you do get a little bit of your own bias, and it's hard to not to do that, to think, oh, I'm scoring higher, or oh, I'm scoring lower. Best to give yourself time to forget, so not to look at what you scored last time before you score again. So if you can have a decent interval between the scoring, that helps take away any of that intrinsic bias as well. But also just things like registering, like any unusual behaviours, writing them down can be really helpful. Even if you're not using the scoring, just making a note on your phone that says, oh, you know, Bella just seemed really hard to settle tonight, and then she's difficult for it to settle again in another 3 weeks. You'd be like, oh no, I did note that down actually not that long ago. So I think documentation is really important. Anything change is where it's at, because you could say, well, dogs should be sleeping on an orthopedic bed. Okay, well, maybe they should, but if your dog likes to sleep on the kitchen floor, then actually for them to start moving to sleeping on something soft for you, that's actually a clinical change. If they've been happy and sleeping on this cool surface, technically it might be, oh yay, they're sleeping on an orthopedic bed, but for them that might be a negative change. There's pain and they're seeking out a different surface.
Yes.
It's not a one size fits all, and I think any change is what owners should really be looking for.
Yes, absolutely. And I don't want to tie everything back to my old dog, but I'm going to talk about Tally again. He needs talking about. So I treated Tally to an Ortholux mattress, one of your very big beds, thinking that he would love it. And it took a really long time for him to even want to stay there. We moved it to a few different places around the house, and every night he just wanted to go and sleep on the sofa until he started having accidents in the middle of the night. And then we're like, you can't sleep on the sofa anymore. So we've set him up a pen in the hallway with his beautiful big mattress. And I think I've said to you before that although it took a couple of weeks for him to accept that that's where he was going to sleep and he was going to be penned in, he goes in with biscuits every night. He goes in and has a biscuit, and now he runs in to have his biscuit. But the thing that I've noticed with him is that in the mornings his mobility is a lot better. Although he wakes up a little bit wobbly, he looks like he's had a good night's sleep. He's laid out flat, but he's been temperature regulated, he's been supported in every area. It's big enough for him. There's no lips for him to fall over, and he can get as comfortable as possible. And he manages to do like a full hour walk. Later in the day, when he's been either having patchy sleep because he follows me around and he's a bit clingy, later in the day he starts to become more ataxic. And he has degenerative myelopathy rather than OA. So, it's, slightly different needs that he would have. But yeah, with a disturbed sleep pattern throughout the day, sleeping on the sofa, by the end of the day, he can't manage even 20 minutes is a struggle. Even with shoes on, we have to take him out in a full body harness if he wants to come, or I just leave him to, he can have a wander around the garden. So it's something that I really noticed is having a good night's sleep gives him that support.
Yeah, and you can't tell them, can you? So you just have to show them. I think psychological safety is such an important part of sleep that when they have been sleeping somewhere that might not be as good for their joints, but they feel really secure and safe there, and they've always slept there, and they associate that space with sleep and protection and feeling good, then it's hard to tell them to go and sleep somewhere that's unfamiliar and doesn't smell like home and doesn't feel the same underfoot or whatever it is. And I think you say sometimes it's important to give dogs time to adjust. We see that sometimes people say, one night the dog didn't like the new bed. Well, I'm not surprised. that doesn't surprise me. Yeah, it takes a while to change the psychological side of sleep, and that is perfectly normal because you can't explain to them. You can't say you're gonna have so much more deep sleep, darling. I know,
and he just feels like he's being shut in somewhere and almost told off. And he's a very sensitive dog to things like that.
And that's quite tricky as an owner, right? It's quite a commitment to make those changes, even if you know it's the right thing. Anything where you've got to kind of get over a hurdle with them of acceptance can be quite difficult. So we often try and help owners through that and talk to them about strategies about bringing in a new bed, exactly things that you've discussed, making it really available, treats, make sure you wash the cover in your normal wash fabric before they use it, things like that. It smells more like home, right, rather than some new fabric. So quite simple strategies. None of it's rocket science, but it's just pulling it all in.
Yeah, so are there any other tips that you could offer owners on just how to make their dog's environment a lot more conducive to sleep?
100%. And it's all about continuity. Dogs love routine. So it wants to be somewhere that feels safe in the same place every night. Just like us, they like to sleep somewhere where when they're asleep, their brain can go into full deep sleep. I feel safe here. It was so vulnerable when we're asleep, right? And it's why when we sleep in a hotel room, you tend not to sleep as well. Even if you might have got enough hours, you tend to spend it in lighter sleep rather than deep sleep, not as much time in the real regenerative stages of sleep, because your brain just doesn't relax quite as much. You're a bit more on edge. You don't know what's happening. You're more likely to wake to the people walking up and down the corridor, whereas you might not wake to your partner going to the toilet. And that's all about feeling psychologically safe. So in the same place, somewhere safe, where they're not going to be disturbed by the children crashing in from school, things like that. Who can access that space? When can they get there? I would suggest it's somewhere that they can sleep at night and in the day. So if they sleep in your bedroom, it's really important that they can get there in the day if they want to go and sleep. Otherwise, it's harder for them to get into that deep sleep in their daytime sleep routines because they're somewhere else. They're in maybe their nap bed or whatever. And it's I think having that access to where they get their best sleep all the time is really important. All the things we'd expect, so temperature, mid-range temperature, not too cold, not too hot, and of course, for them as for us, what the right temperature is quite dependent on them. If a little Chihuahua versus a Husky, it's going to like a different ambient temperature.
Yeah. Even my 2 pointers are completely different.
Absolutely, but trial and error about what they like. Scent can be really important. So if you've got anxious dogs, DAP diffusers and things like that can be really helpful. Going to close, especially for a new environment. Sound, we can talk about getting rid of other ambient noises using white noise or radio. Things that can be really helpful. Pink noise, brown noise. There's all sorts of different types of noise. Did you know that?
I didn't know that.
Yeah, which is absolutely fascinating. Some more to mimic heartbeats or rainfall, different cadences of sound. So you never know. Your dog might be a pink noise kind of a dog over a white noise kind of a dog.
He might be.
You just don't know, right?
No.
There's a whole world of sound rainbows out there.
Yeah.
Really, loads of things that we can try, but really, routine is what sits at the heart of all that. And as well, your wind down routine and your wind up routine in the morning.
Yeah, so definitely routine seems to be a
100%.
big factor.
Light, I didn't even mention light, a huge one. Making sure that we're dimming the lights, or closing the blinds in their room as well when they're trying to get to sleep. They work on circadian rhythm, same as us. So
there's a whole other podcast in there, isn't there?
Oh God, I mean, I could speak for hours, absolutely hours.
So looking ahead to kind of the future of sleep research, is there anything coming in dogs? Is there anything coming in humans that we could kind of cross over and extrapolate from?
There's so much we could do. It's just fascinating what's going to happen in the sleep space in pets over the next 10, 20 years. A lot of the stuff that we see in humans is only now coming out over the previous 20 years, and there's so much more to do. But what we've seen is people looking at sleep much more as part of their holistic routine, and we have a lot of research coming out of the human sleep space, and where we've looked for correlation in pets, we've almost always found it. There is a lot still to know in the pet sleep space, but I think we also need to look at what a good friend of mine calls evidence-based pragmatism. So if we've shown it in people and we know that a lot of the mechanisms are the same when we're talking about that neurobiology, we're not going to do any harm by optimizing sleep, I think we need to see it as kind of guilty until proven innocent. And that's a lot of the stuff that we talk about is here's what we know and here's what we assume.
Yeah.
Hey, anyone who wants to fill any of those gaps, I'm here, give me a call.
I really look forward to that research. I do find it fascinating. And actually, on my drive down here, one of the podcasts I was listening to was about sleep quality in humans. And they were talking a lot about sleep trackers being both positive if you're in a place to be able to make changes, but also possibly negative if you are maybe more anxious about the results.
Absolutely.
Do you see that in kind of owners monitoring dogs?
Yes, I think it depends on how fixated a thing that becomes, because if checking it religiously all the time, it becomes a source of anxiety. I mean, dogs will pick up on your anxiety, and that starts to knock that psychological safety. That what if you're worried? Well, I think I should probably be worried too, in which case I'm not going to sleep very well. And sleep trackers as well they're not perfect in terms of the information that they deliver. What they're good at doing is tracking change. Matt Walker, who does the podcast and wrote the book Why We Sleep, says that the best sleep tracker you can have is the one that you'll routinely wear. So it's
consistency.
Yeah, exactly. Yeah. Because what we find is that maybe even the best sleep trackers for people are about 70% accurate in terms of sleep stage and things like that. But what they are good at is saying if your deep sleep's increased by a couple of percent, that's probably likely true. But that actual percentage number is unlikely to be accurate. So it's about the tracking rather than the specific data of every night. And with dogs as well, remember right at the start I said they spend a lot of time in this real chilled out, almost sleep state, which is why we get up to kind of 14 hours of rest. But a tracker has no idea about the difference between rest and proper sleep. It just does movement or activity versus inactivity. So especially for older dogs who might spend quite a lot of time in a real sedentary position but aren't asleep, you're not actually tracking sleep, you're tracking lack of
Tracking
activity.
rest.
So it can be quite misleading in those cases.
Okay.
I think they're interesting. I think they'll get better, but I think they need to be part of a real holistic look at sleep.
Yes, yeah, absolutely. Okay, well, it's been a really, really interesting conversation. And as you know, I like to end my podcasts by asking what 3 things you think are kind of most important about what we've spoken about today and what you would like our listeners to take away.
I think for starters, that sleep is important. I think one of the things that we have not necessarily been good at as pet healthcare providers is allowing owners to bring sleep into the consulting room. We don't ask about it and they're not sure if we're interested in it, and therefore it often doesn't get brought up. And actually it can be a huge impact on caregivers. Caregiver burden of a dog that is up all night is huge. So it's a really important wellness check for our owners as well as our dogs to make sure that we can support them. So I think talking about sleep at all is number one. I think the second thing would be that you can make a lot of difference with very simple, often free changes. Don't get me wrong. I literally have a dog bed company, right? I know that the right bed is really important, but you can make a lot of changes without that, right? It doesn't matter. An owner says, I cannot afford anything. That's not a problem. We can still talk about sleep. We can still make really active changes. Where are they sleeping? What temperature are they sleeping at? What is our nighttime routine looking like? What is the light exposure looking like? When are we exercising? How much are we exercising? What brain stimulation are we having in the day? Hundreds of things that we can still talk about without spending a penny. And I think that's really important, that it's a lovely topic where you can make seismic change to every single patient you treat will sleep. Every single one. Jellyfish sleep, right? Everything sleeps, right? So every patient sleeps, and every patient's sleep can be impacted by things that cost nothing. What an incredible topic to be able to talk about, especially in the cost of living crisis, right? Amazing.
Yeah.
And 3, my last one would be not to underestimate the impact that poor sleep has on everything else that you're dealing with, the clinical conditions. It is not just that clinical conditions cause bad sleep. It is that bad sleep will bring about worsening of chronic conditions and, in fact, even acute pain. So don't write it off. It's not just a symptom.
Yeah. And that's just a really important fact to end on. So once again, thank you very much for joining us on the Nupsala podcast.
Always happy to be here. Please, I've got so much more to say. Keep calling me back.
Thank you.
Thanks for tuning in to the Nupsala podcast. This is one of many insightful episodes that we have in store for you. You can stream the episodes on Spotify, Apple Podcasts and Amazon Music. Simply search the Nupsala podcast. You can also watch on YouTube or directly at nupsala-learning.co.uk. If you'd like to stay up to date with all our latest content, please follow us on social media, where we always post when a new episode launches. All the links and details are in the bio. Thank you.